Bonjour à tous et à toutes. I think we will just get going. Today, speaking and here with us are Dr. Tam, Dr. Njoo, myself, Dr. Wong, and I'd like to highlight the presence by video conference of Minister Jordan, who, being a minister from Nova Scotia, has been through a lot, and indeed all of Canada has been through a lot. But in particular, I want to thank her for being here because in particular she is grieving. But we are all grieving, and we're all here with you, Bernadette. So I do want to thank you for being here. But again, our hearts are still heavy given what has gone on in Nova Scotia over the past week. So thank you. I think we'll get right to it. Dr. Tam will speak first, followed by Dr. Njoo, followed by myself, and then Dr. Wong, and then Minister Jordan.
Hello, everyone, and bonjour à toutes et à tous. I'll just start with the usual update on the numbers of COVID-19 in Canada. There are now 44,364 confirmed cases, including 2,350 deaths. To date, labs across Canada have tested almost 670,000 people, with about 7% of these testing positive. Today marks the start of National Immunization Awareness Week. As we're now in the midst of a global infectious disease pandemic, I cannot imagine a more poignant time to talk about the benefits of immunization. As we reflect on the importance of vaccination this week, I'd like to highlight an unsung hero of vaccinology, Dr. Morris Hillman, whose career is an inspiring outline of our modern vaccine era. Dr. Hillman was a virologist and vaccine scientist who helped to develop 9 of the 14 vaccines that are routinely recommended for children today. Vaccines that prevent measles, mumps, rubella, chickenpox, meningitis, Haemophilus influenzae, and other infectious diseases. Known for his focus on safety and reducing vaccine adverse events, Dr. Hillman was also the original vaccine fast tracker, owning to his mastery of the science of vaccines and the myriad processes from research through federal regulation and delivery. It was this unique ability that enabled him to develop and fast-track a 1957 pandemic influenza vaccine, preventing untold illness and deaths that winter. With the COVID-19 pandemic still in high force, there is an urgent need for this accelerated process, focused on delivering a safe and effective vaccine, and the world is responding in equal force, with 20 institutions and companies working on expedited vaccine development, while over 70 countries are working collectively to accelerate research on treatments. But there is one more lesson from Dr. Hillman that we must heed today. Though a hero who saved hundreds of thousands of lives with a pandemic vaccine, he never lost sight of the millions of lives that could be saved with routine vaccination programs for existing infectious diseases. For that, he is credited with saving millions of lives, more than any other scientist in the 20th century. This brings me to my key message today. We are in a pandemic, and we have all committed to protect ourselves and our families with physical distancing, to stick to essential activities only. So my message is that vaccination is an essential activity. It is normal to feel concerned about visiting a doctor's office or clinic at this time, but please know that healthcare providers have precautions in place to prevent the spread of infection, like screening patients before appointments and staggering patient times to maintain social distancing. Contact your healthcare provider to find out ways to safely make sure that your family's vaccinations are kept up to date. This is a life-saving essential must-do. Thank you.
Thank you, Dr. Tam. Dr. Njoo.
Bonjour. On commencera par les derniers chiffres sur la COVID-19 au Canada. Il y a maintenant 44 364 cas confirmés, dont 2 350 décès. À ce jour, les laboratoires du Canada ont testé près de 670 000 personnes, dont environ 7 % ont eu un résultat positif. Aujourd'hui marque le début de la Semaine nationale de promotion de la vaccination. Puisque nous sommes en pleine pandémie mondiale d'une maladie infectieuse, on ne peut imaginer un moment plus propice pour parler des avantages de l'immunisation. Cette semaine, au moment où nous réfléchissons à l'importance de la vaccination, on aimerait attirer votre attention sur un héros méconnu de la vaccinologie, le Dr. Morris Hillman, dont la carrière rend compte de façon inspirante de notre modèle de la vaccination. Le Dr Hillman était une virologiste et une spécialiste des vaccins qui a contribué au développement de 9 des 14 vaccins qui sont de nos jours systématiquement recommandés aux enfants pour les prémunir de la rougeole, des oreillons, de la roubiole, de la varicelle, de la méningite, de l'infection de Haemophilus influenza et d'autres maladies infectieuses. Reconnu pour son souci et l'inconnuité de la réduction des effets indésirables des vaccins, le Dr Hillman a également été le premier à concrétiser l'homologation accélérée des vaccins, une réalisation rendue possible grâce à sa grande maîtrise de la vaccinologie et de la myriade des processus entourant la recherche, la réglementation fédérale et l'administration proprement dite des vaccins. C'est cette capacité exceptionnelle qui lui a permis de synthétiser un vaccin contre la grippe qui sévissait lors de la pandémie de 1957 et dont accéléré le développement. Grâce à lui, un nombre incalculable de cas et de décès ont pu être évités cet hiver-là. La pandémie de la COVID-19 étant toujours très présente, il est urgent de recourir à ce processus accéléré pour mettre au point un vaccin sûr et efficace. C'est d'ailleurs une tendance que l'on peut voir se dessiner dans le monde entier avec force et détermination. 20 institutions et entreprises travaillent actuellement au développement accéléré d'un vaccin et plus de 70 pays s'emploient collectivement à accélérer la recherche de traitements. Or, il y a une autre leçon de Dr Hillman dont nous devons tenir compte aujourd'hui. Bien qu'il soit un héros qui a sauvé des centaines de milliers de vies grâce à un vaccin antipandémique, le Dr Hillman n'a jamais perdu de vue les millions de vies qui pouvaient être sauvées au moyen de programmes de vaccination de routine contre les maladies infectieuses existantes. Pour cela, on lui attribue le mérite d'avoir sauvé des millions de vies, plus que tout autre scientifique du XXe siècle. Cela m'amène notre message principal. Nous sommes en pleine pandémie et nous nous sommes tous engagés à nous protéger, ainsi que nos familles, par des mesures d'éloignement physique. Nous nous sommes engagés à nous limiter nos activités essentielles. Donc, et c'est notre message d'aujourd'hui, nous devons considérer le vaccin comme étant une activité essentielle. Il est normal en ce moment de se sentir préoccupé par une visite chez le médecin ou dans une clinique, mais sachez que les professionnels de la santé ont mis en place des précautions pour prévenir la propagation de l'infection, comme le dépistage des patients avant les rendez-vous et l'étalement des visites pour préserver l'éloignement physique. Contactez votre professionnel de la santé pour connaître les moyens mis en place pour vous assurer en toute sécurité que les vaccins de votre famille sont à jour. Il s'agit là d'une mesure essentielle et incontournable pour sauver des vies. Merci.
Merci, Dr. Njoo. Bonjour, Kwe, Sego, Tanse, Ulukut. Good afternoon. This week, we have seen an increase in the case counts in First Nations communities. As of April 24th, there have been 95 confirmed cases of COVID-19 in First Nations communities on reserve and 14 confirmed cases in Nunavix Inuit communities. Si le nombre de cas reste relativement faible dans les communautés autochtones à ce jour, nous suivons la situation de très près. Nous nous engageons activement auprès des dirigeants locaux et des autorités de santé publique et nous faisons tout notre possible pour que ces communautés disposent de tout ce dont elles ont besoin. Nous travaillons également en étroite collaboration avec les communautés de tout le pays pour veiller à ce qu'elles soient toujours préparées à faire face à une augmentation du nombre de cas. A false sense of security can lead to devastating results. There are a number of immediate actions that can be taken that have proven to be the most effective means of slowing the spread of the virus. Ones many of us have become quite familiar with, but which are worth repeating, namely hand washing, physical distancing, no large or even small gatherings, self-isolation, and active identification of symptoms. We count on Indigenous leadership to persist in their efforts to share this message with their communities. To date, we have distributed, in addition to supplies provided by provinces and territories, 160,000 gowns, 500,000 gloves, and close to 200,000 surgical masks in communities. We also saw positive progress today in terms of our support for urban Indigenous populations. This week, 94 programs were supported through the Indigenous Community Support Fund. These programs support a variety of Indigenous measures that help youth, homeless individuals, and elders by providing food baskets, childcare, mental health supports in urban settings principally. We're proud to be supporting, among other, the Friendship Centres as they continue their important work for vulnerable urban Indigenous communities in the face of this pandemic. We are also working quickly to get the funds out of the door for the 94 accepted submissions, and we have streamlined the process so that funds can flow directly to Indigenous communities and groups across the country in very short order. We recognize that more support is needed. And as I've said before, this should only be viewed as the start of our support for urban Indigenous populations in particular. Cette semaine, le Premier ministre a annoncé une aide de 9 milliards de dollars pour tous les étudiants, dont un montant supplémentaire de 75,2 millions de dollars de soutien fondé sur les distinctions pour les étudiants poursuivant des études postsecondaires autochtones. To the First Nations, Inuit, and Métis youth, you may be worried about your future, whether it's your financial situation, your employability, or the continuity of your studies. And I want you to know that as you face unique challenges in addressing COVID-19, we will make sure that you have the financial assistance that you need when you need it. This new funding is over and above the base funding each Indigenous distinctions-based program receives to support post-secondary education and will cover costs such as support for living, travel, counseling, and other support expenses to ensure the success of Indigenous students. This funding is also over and above the measures announced by the Prime Minister this week. Indigenous students can access all of the other student supports that fall within the larger COVID-19 economic response plan for post-secondary students, including the Canada Emergency Student Benefit, the new Canada Student Service Grant, and the Enhanced Canada Student Loans Program. Je tiens également à saluer les Rangers des Forces armées canadiennes qui sont actuellement au Nunavik, en Basse-Côte-Nord, à Nutashquan et à Uquanashit. Ils apportent un soutien inestimable, notamment en distribuant de la nourriture, en installant des tentes et du matériel médical et en sensibilisant le public afin d'aider les autorités sanitaires et les communautés dans leurs efforts contre la COVID-19. I'm grateful for the collaboration between the government, public health departments, provinces, territories, Indigenous leaders, elders, and community members. We are all focused on the public health response that will save lives. Miigwech, Nakumik, Marcy, thank you. Merci. Dr. Wong.
Thank you. I would like to acknowledge that we are on the traditional and unceded territories of the Algonquin people. Il y a plusieurs façons de rester en bonne santé. Cela comprend éviter les voyages non essentiels. Physical distancing is the best way to contain the spread of COVID-19 by keeping at least 2 arms length away from other people. As well, no gatherings or group outings, and limiting contact with people at high risk, such as elders and those in poor health. However, I encourage immunization, physical exercise, and getting onto the land. Individual harvesting and fishing are excellent ways to connect with culture and support your mental health while respecting physical distancing. Nakumik, merci, miigwech, merci et thank you.
Merci, Dr. Wong. Et maintenant, je passe la parole à la ministre Jordan. Minister Jordan.
Thank you. Good afternoon. Bonjour. Kwe. Before I begin, I would like to just take a moment to thank Canadians from coast to coast to coast who have been so wonderfully supporting of Nova Scotia. This past week has been very difficult for us, but your love, support, and condolences have meant a great deal to all of us, so thank you for that. The women and the men who work in Canada's fish and seafood sector are the economic drivers for many of our coastal and rural communities. They've been feeding Canadians for generations, and we need them to continue to do that in these very challenging times. When the industry is strong, everyone does well. But when it hurts, we all hurt. Lorsque l'industrie est forte, tout le monde se porte bien, et quand ça fait mal, nous souffrons tous. We have been in constant contact with harvesters and processors to understand what they need for a safe, strong season. One of the things we've heard are real concerns about the ability to move product from both storage capacity and a market perspective. Without the ability to move goods efficiently and effectively, processors can't buy more from our harvesters, and in turn, they can't supply Canadians with seafood. Bolstering our processing sector will be vital to supporting the fish harvesters and feeding Canadians this season. So today we're announcing $62.5 million for the new Canadian Seafood Stabilization Fund, which will go directly to the fish and seafood processing sector. This funding will support the industry as they increase cold storage and inventory capacity, allowing them to process more from harvesters and feed more people. Retool their technologies and marketing efforts to meet the shifts in consumer demands and create value-added products, and put in place enhanced health and safety measures to minimize risk to workers, among other things. We've always said we would adapt our measures as this situation progresses to tackle new challenges head-on, and that hasn't changed. We know this is a difficult time, but our government will be here every step of the way as we weather this storm together. We're actively exploring other ways to support harvesters and the industries as we move forward. But today's announcement will provide immediate support to the industry, help ensure access to this important food source, and help position the sector to return at full strength once the pandemic is over. The industry has faced tough times before, but the people who work in our fish and seafood sector are determined and resilient, and I have full confidence that we will get through these hard times too. Thank you. Merci. Walalin.
Merci, Madame la Ministre. Et maintenant, nous sommes impatients de prendre vos questions. Carl?
Thank you, Minister. So as usual, we'll start with 3 questions on the phone, 1 question, 1 follow-up. Operator?
Thank you. Merci. Once again, please press star 1 on your telephone keypad at this time to ask a question. Veuillez appuyer sur étoile 1 maintenant pour poser une question. Our first question, notre première question, nous vient de Catherine Lévesque avec la presse canadienne. Please go ahead. Your line is now open.
Oui, bonjour à tous. Ma première question, en fait, serait pour Dr. Njoo. Je voulais savoir quelle était votre position sur les passeports d'immunité. On en parle beaucoup ces temps-ci et voilà, l'OMS dit que ce n'est pas prouvé en fait encore que les personnes qui ont contracté la COVID-19 sont immunisées. Donc, je me demandais quelle est votre position là-dessus. Est-ce qu'il faudrait quand même se pencher sur cette idée de passeport?
Oui, merci beaucoup pour la question. Avec la COVID-19, on sait que c'était vraiment le virus, c'est un nouveau virus et on est en train encore d'apprendre, d'avoir beaucoup d'apprentissage avec la science qui continue à évoluer. Jusqu'à date, avec l'expérience dans les autres pays, aussi avec les données probantes qu'on a eu à analyser, on sait que il y a des personnes déjà infectées avec le virus qui ont eu une réponse et réaction avec les anticorps. Mais qu'est-ce qui n'est pas clair à date, c'est si les anticorps donnent une immunité et pour combien de temps. Jusqu'à date, aucune évidence que avoir eu une infection donne une immunité à long terme ou à vie. Donc, on n'est pas prêt pour dire que, OK, si quelqu'un a déjà eu une infection, c'est correct, tout va bien, on a après une immunité à vie. Donc, je pense que c'est quelque chose à suivre et on continue à regarder c'est quoi la science, c'est quoi l'évidence qui nous montre dans des jours et des semaines à suivre.
Merci beaucoup, Dr. Njoo. Et mon autre question, je ne sais pas si vous pouvez y répondre, M. Miller, peut-être. J'avais demandé hier à Mme Freeland où en était-on avec cette demande de l'Ontario et du Québec pour avoir des militaires là, dans les CHSLD, les soins de longue durée. Donc, je me demandais, avez-vous des nouvelles sur ce front-là?
Vous avez peut-être entendu le point de presse du premier ministre, Catherine. Pour l'instant, nous faisons de la reconnaissance au niveau des médics de l'armée, des forces armées canadiennes, pour savoir quels sont les besoins. Donc, un triage initial, c'est un triage qui se fait présentement et qui se fera dans les prochains jours, quitte à faire une réévaluation pour voir quelles sont les demandes. Donc, c'est quelque chose qui se fait à l'instant même, dans la mesure où les gens les forces armées canadiennes puis les médics qui sont connectés vont être déployés dans les régions du Québec pour faire le triage initial de reconnaissance.
Merci, Monsieur le ministre. Opérateur, prochaine question, s'il vous plaît.
Thank you. Merci. Our next question, notre prochaine question, nous vient de Theresa Wright with the Canadian Press. Please go ahead. À vous la parole.
Good morning. I'd like to ask Minister Jordan about the announcement today. It was specifically focused on fish processors, but fish harvesters, including lobster fishers in the Maritimes, are grappling with the decision about whether to set their traps and incur the considerable costs when it comes to that, with no financial package specifically aimed at them. Is there help coming for fish harvesters, and specifically, will the wage subsidy be extended to lobster fishers for their spring season?
Thanks for the question. Absolutely. The message today is for the processors. The announcement today was to address concerns that we've heard from the processing sector, but we also recognize that in order for the harvesters to continue to fish, they have to be able to sell their product. That's one of the reasons why the processors are the people that are first out the door. We are actively exploring other measures that will definitely impact other sectors, other areas in the sector. We know it's important to listen to harvesters. We know that there has been some challenges with them actually accessing the funds that have already been announced. We're continuing to look at all of these things that need to be done, and we'll be continuing to follow up with new measures as we go forward.
Theresa, follow-up?
Yes, thank you. Minister Miller, several First Nations in Canada were dealing with suicide crises before this pandemic started, and we know that COVID-19 is only going to have a compound mental health impacts on many First Nations, Inuit, and Métis persons who are suffering from, intergenerational trauma caused by colonialism. Why are mental health resources not a bigger part of the pandemic response, especially for Indigenous communities?
Well, Theresa, as we follow the evolution and the impact of the epidemic, particularly in the portfolios that I am responsible for, we know that the impact on Indigenous communities is high on many fronts, including the impact on mental health, a component of which is suicide. Our teams are working actively with communities to increase the capacity in support for people that are suffering. This is something that will evolve over time as communities implement the health directives, make sure that they are looking in on each other and that we are supporting them in a comprehensive way that we need to do. As you mentioned pertinently, COVID-19 has a compounding effect on all the pre-existing conditions that Indigenous communities are subject to. That is a wide generalization because these preconditions vary from community to community, but on the whole, the social determinants of health create conditions where COVID can run rampant, has that potential to run rampant. The apprehension and fear that exists within the communities is real, and that has an impact on mental health. We, as part of Indigenous Services Canada, a large amount of the support that we provide turns in and around supports around mental health. Those continue, but as this epidemic and all the impact that it can have, particularly on the well-being of people's, is assessed and continually reassessed, we'll stand ready to provide that support. I'd ask actually Dr. Wong to add a few words.
We work with Indigenous partners to ramp up the implementation of First Nations mental wellness continuum framework, as well as the national Inuit suicide prevention strategies. Those are Indigenous-led efforts, and we are fully behind supporting those efforts during these very trying times.
Thank you, Dr. Operator. Next question, please.
Thank you. Merci. Our next question, notre prochaine question, is from Mélanie Marquis avec La Presse. Please go ahead. À vous la parole.
Merci beaucoup. Good afternoon. My question is for Dr. Tam. How worried are you about an anti-vaxxer movement in Canada when it comes to the eventual COVID-19 vaccine? Is your department tracking groups, watching social media to prepare to such possibility?
So as I've said, there's a global effort in the discovery and the research on looking at safe and effective vaccines for COVID-19. So that is not a reality as yet, and we think it would take some time. But as a whole, what we want to do is to make sure we get the information out to parents and to Canadians about the safety and effectiveness of vaccine as a key component of keeping people healthy in Canada. And we are not immune to the incursions of very contagious pathogens like measles, for instance. So that is something that globally we are quite concerned about after people are coming out of their sort of homes in more less sort of physical distancing would potentially mean that there could be outbreaks. And so this is why we're asking people to set up appointments, find out how you can get vaccinated even during this time, because it's an essential service. I think, in terms of looking at people who have questions about vaccination, we're there to answer the questions based on the scientific facts. I think prior to this particular pandemic, I've been working quite hard with not just the medical community or pediatricians, but also with parents and parent influencers, as well as social media platforms, to look at how we can address the disinformation and misinformation about vaccinations. So that will continue.
Mélanie, en suivi?
Oui, merci, Carl. So just to make sure, Dr. Tam, are there any indications that such combat will be necessary to fight against misinformation, and also Mr. Trudeau addressed the need for a national plan today about reopening the economy. Do you think we should, since the situation is different from one province to another, would you recommend that we close or we shut down inter-provincial travel?
So just to finish off the first question, I think, is that we won't really know much about the vaccines until they've been further developed. And we do need to ensure safety and effectiveness. So I think the key is to communicate those facts. I can't predict what is going to happen in terms of the uptake for the public, but we will definitely, like in all immunization programs, take public education and awareness into account. It's difficult to say, actually, because in our experience, even in the middle of a pandemic, like the pandemic of influenza, you can't really tell. Sometimes it's quite an emotional reaction. I recall in the last pandemic, when you get an increase in deaths, for example, people will suddenly want to take up the vaccine very, very fast when you don't actually maybe have enough to go around as the vaccination programs are rolled out. So those dynamics we can't actually comment on at the moment, but it's something that we're aware of.
And I just would add that as we, as a society, face a number of challenges over the years with respect to complacency and how vaccines are are regarded. This is also an opportunity to combat that disinformation with awareness as to what the importance of vaccines are. And as we see, as we see our elders and people in long-term care facilities exceedingly vulnerable and dying in indignity, this is also an opportunity to reinforce the point and the importance generally of vaccines. And when you talk about Indigenous communities, there is sometimes a legitimate skepticism with the way the medical services have been provided in the past, and various access to medical services, but also the way it is regarded. And so that is an additional hurdle. We're always fighting disinformation, but this is also an opportunity to raise awareness as to the importance of vaccines.
Thank you, Minister. Ashley?
In terms of the second question, I think we are working very closely with all chief medical officers to look at the conditions upon which some easing of the public health measures should be taken. So that, I think, it forms the foundation of some of the decision-making on what needs to be done. I think each community has very different needs. For example, we heard about some cases in northern Saskatchewan, and that means protecting those communities are very important. And so even within a province, so those decisions are taken at a very sort of local and provincial level as well to protect those communities. And so, but we need the foundational public health approach, and then there needs to be some flexibility in terms of protecting communities on the ground.
Good morning, Dr. Tam Ashley for CBC News. I'm hoping you can expand on what Dr. Njoo said about immunity passports and certificates. Could it be effective?
So I think the answer is we don't actually know yet. I think just this last few days we talked about the immunity task force, and some of the objectives of that task force is to conduct the necessary research in order to help us interpret what serological testing results mean. So by that, I said it is a very novel virus. We actually don't understand the immunology of this virus very much. We've got some idea now about some of the antibody response, and some of these responses are quite delayed. We don't know when the sort of peak of the antibody response might be reached. We definitely don't know how long the antibody response might last for, and what it means if someone gets reinfected. So all of those are unknown. The other unknown right now is also the performance of some of the tests, and that's partly related to the understanding of immunology. But each test performs differently, and so our National Microbiology Lab, having evaluated a range of tests, shows that a lot of them are not sensitive or specific enough, which means you could, in fact, get false positives where someone thinks they may have antibodies and they don't, or the lack of, false negatives as well, and specificity. So those are sort of evolving knowledge. And so I think from our perspective, if you had a test, what we need to do is do these studies so that you know how to interpret that test. So I do think it's premature to sort of think about the concept of a passport.
I'm hoping you can talk about herd immunity. Quebec's premier has said that allowing a large number of non-vulnerable people to get the virus naturally in Quebec would be the best defense against a second wave that could be potentially worse and even overwhelm the hospital system there. Do you recommend this approach to provinces and territories? Could it be the new normal?
I think part of the immunity task force is also to have a look at what the level of immunity is in our Canadian population. We actually don't know that. And I think, as we all appreciate, the number of reported cases is an underestimate of the number of people that have got the infection. So I think that is the first step. I think given the incredible public health response and the response of Canadians to do the physical distancing, it is possible that the level of immunity is quite low. And what I do know is that while this particular virus can have a very devastating impact on seniors, our elders, and those with underlying medical conditions, it can actually result in quite severe outcomes, even for the young and for the rest of the population. So, the idea of sort of generating natural immunity is actually something that is not something that I think should be undertaken. I personally think that, we, as the chief medical officers, we would, really be extremely cautious about that kind of approach. You never know if you, even as a young person, might get severely sick or get into the ICU. So it's not a concept that should be supported.
Rachel Haynes from CTV National News. My question is for Dr. Tam. We're talking a lot about the science behind antibodies, but we also know that a vaccine is what will help us return to the new normal, as the Prime Minister has said. How confident are you that a vaccine will actually be effective in combating the spread of this disease?
I think the honest answer is we actually don't know at the moment at all. I think that there are some promising candidates that are in very early development. And because we don't understand the immunology of the virus enough, it is a very premature, thing to even try to comment on, whether we'll actually get a vaccine. And then if we do get one, then how effective it is. The other thing that we don't know about is the evolution of this virus. What would this virus be like in another year? And how would that affect the effect of the vaccines are all unknowns. But what I am heartened about is the amount of research that is going into this at the moment.
And given that it's too premature to even be talking about the effectiveness of it, the Prime Minister has said multiple times over the last few weeks that we will only return to normal if we get this vaccine. But today we're talking a lot about reopening the economy. So is it premature to even be at that step right now when the science is so unclear at the moment?
Well, I think what is really important is absolutely focus on eliminating this first wave. That is really, really critical, and be very, very cautious about it. All of these outbreaks in these high-risk settings must be addressed. There must be plans to prevent further infections in long-term care homes, in acute care settings, in the sort of crowded living conditions. That actually has to be in place, as well as the testing strategies, increasing the number of tests. So there's a number of conditions upon which I think we can cautiously move to what I would call a new normal. So we're trying to balance very carefully the public health measures against disease activity. The moment that we're going to see some uptake in disease activity, you're going to have to be able to react to that and rapidly contain any of these outbreaks. So I think as we've observed, the epidemiology is quite different across the country. So there will be some differences in the timing, but tread really, really cautiously, because I think that the chains of transmission will be reignited very rapidly should we don't take absolutely great care as we come down that slope on the other side of the epidemic curve.
Merci, Dr. Tam. On va retourner au téléphone pour 3 questions. Opérateur.
Thank you. Merci. Our next question, notre prochaine question, is from Savannah Aubie from Brunswick News. Please go ahead. À vous la parole.
Hi there. My question is for Minister Jordan. We're hearing concerns here in New Brunswick about the federal government bringing in 150 temporary foreign workers to help work in Shediac lobster fisheries. I'm wondering when these workers are expected to arrive in the province, and have you received pushback in trying to bring these workers in to support the sector?
We've heard from the sector how important it is to have the temporary foreign workers. One of the big concerns we're hearing from processors is their ability to have a secure labor force. That's one of the reasons why we made temporary foreign workers people who are able to come into Canada. They do have to follow all of the public health guidelines with self-isolation once they arrive. That's critical. But we know that it's extremely important that we have that labor source in order to keep the food supply chain open. That's one of the reasons that we've allowed this to happen. It's extremely important in agriculture and the fish and seafood sector.
Okay. And thank you. I'm wondering, on the aid announced today, when can seafood processors expect to receive the funding, I guess, in their accounts to get started on introducing these measures? And what criteria will they have to meet in order to qualify?
So the funding is actually going to flow through the regional development agencies. In Atlantic Canada, it'll be ACOA. In Quebec, it'll be DEC. And on the West Coast, it'll be Western Diversification. We are looking at now the ways that it's able to get it out the door as quickly as possible, because we know how important this is for our processors to have these funds. Today's announcement will actually provide provide stabilization for them so that they know it's there, they know that they can access it. Many of them have ongoing relationships with our regional development agencies, so we felt that this was the quickest and easiest way for them to access the funds.
Thank you.
Thank you, Minister. Operator, next question, please.
Thank you. Merci. Our next question, notre prochaine question, is from Philippe Vincent Foisy avec Radio-Canada. Please go ahead. Your line is now open.
Oui, bonjour. La question est pour M. Njoo. J'aimerais comprendre, quand on va commencer à avoir du déconfinement, à quoi ça va ressembler dans les commerces, dans les salons de coiffure, par exemple, et autres, en termes d'équipement de protection. Est-ce que tout le monde va devoir porter un masque, tout le monde va devoir porter des gants? Êtes-vous capable de nous expliquer à quoi ça va ressembler, la protection personnelle après ou pendant le déconfinement?
Merci pour la question. On est en train actuellement d'avoir les bonnes discussions avec nos homologues, Dr. Tam et moi, avec tous les médecins hygiénistes en chef de toutes les provinces et territoires. Et on commence à discuter, c'est quoi les principes ou les critères, peut-être pour assouplir les mesures de santé publique. Par exemple, un critère, un principe, c'est OK, est-ce que dans une région, dans une communauté, est-ce que la transmission communautaire est bien maîtrisée? Il faut aussi assurer que la capacité pour dépister la population est bien établie. Aussi, le système de soins de santé, aussi santé publique est bien équipé pour faire le traçage des contacts, aussi pour gérer les gens dans les hôpitaux. Il y a toutes sortes de critères. Si on a aussi des indices que les cas sont peut-être bien contrôlés, on est prêt avec beaucoup de prudence, peut-être assouplir quelques mesures de santé publique. Par exemple, peut-être pour les activités dehors, c'est possible qu'au fur et à mesure, quelques provinces, ça dépend où ils sont avec leur propre, comme on dit, courbe épidémique, peut-être peut permettre les gens à faire quelques activités, peut-être la randonnée dans un parc avec toujours la distanciation physique. Pour les autres entreprises, c'est aussi une bonne question. C'est vraiment une discussion détaillée. Et, en ce moment, on n'est pas prêt à donner plus de détails parce que c'est une discussion active et aussi, c'est aussi toujours, comme on dit, informé par l'évidence et les données probantes. Donc, on va peut-être être prêt dans quelques jours, peut-être dans la semaine suivante, à fournir plus de détails, mais c'est même une conversation en continu, même aujourd'hui. Demain.
Juste là-dessus, est-ce que...
Philippe Vincent, si je pouvais rajouter un tout petit peu sur ce que le Dr. Njoo a dit, je pense qu'il serait ça ne serait pas responsable de parler de façon générale de déconfinement. C'est clair qu'il y a une nouvelle normale, mais comme la Dr Tam l'a dit très clairement, elle a parlé de première vague. Ça veut dire qu'il y a un risque de deuxième vague. On voit des pays qui ont bien réussi maintenant subir une deuxième vague parce qu'il y a eu un déconfinement hâtif. C'est clair qu'il y a une nouvelle normale. C'est clair qu'il y a des données probantes qu'il va falloir examiner, qu'il va falloir regarder de façon assidue, mais toujours basées sur les données probantes de la science. Ça dépendra évidemment des courbes épidémiques qui existent, que ce soit dans différentes provinces, différents territoires, différentes communautés autochtones. Il y a différentes stratégies qui pourraient être examinées. Mais maintenant, de façon générale, de spéculer sur le déconfinement, ce serait irresponsable parce que c'est une analyse qui doit se faire de façon continue, basée sur la science qui évolue de jour en jour et évidemment basée sur des choses que nous n'avons pas faites de façon massive pour l'instant, c'est-à-dire le testage en masse des communautés, les tests sérologiques qui doivent se faire dans les mois à suivre. Et toutes ces informations informeront par la suite cette discussion de déconfinement selon la nouvelle normale, tant et aussi longtemps que nous n'aurions pas développé et déployé un vaccin.
OK. En question de suivi, je vais essayer d'être peut-être plus simple parce que ma question portait sur le matériel de protection puis vous n'avez pas du tout répondu là-dessus. Là. Est-ce qu'on va avoir assez de stock de matériel de protection pour protéger tout le monde quand on va commencer à faire du déconfinement? Parce que vous avez beau dire qu'il n'y en a pas ou qu'on n'est pas rendu là, les provinces sont rendues au déconfinement. Donc, est-ce qu'on va avoir assez de stock pour protéger les gens? Et, M. Njoo, j'aimerais vous entendre en français sur l'immunité collective. Mme Tam en a parlé, mais en français, est-ce que c'est quelque chose de réel, l'immunité collective? C'est quelque chose d'abstrait parce qu'on n'a pas encore des données probantes là-dessus?
OK, merci pour la question. Pour la question de, comme on dit, de l'équipement de protection individuelle, on a déjà souligné le point qu'il y a une différence entre, comme on dit, les masques de calibre médicaux. Il faut absolument consacrer les masques comme les N95 pour les travailleurs de soins de santé, aussi les travailleurs essentiels sur le train en première ligne. Si on parle de la population générale, on a aussi un peu d'évidence maintenant qui indique que c'est peut-être une option, c'est bon, peut-être si les gens ont peut-être peu de symptômes, que si on n'est pas capable de peut-être garder une distanciation physique de 2 mètres si on sort de la maison. C'est sûrement aussi pour quelque chose d'essentiel, peut-être dans un transport en commun ou à l'épicerie. C'est une option de porter aussi, comme on dit, un masque non médical. Donc, je pense au fur et à mesure, je vois maintenant même sur les sites l'Internet, il y a toutes sortes des masques non médicaux disponibles à vendre, mais aussi on est capable avec les instructions, et même sur notre site web, les instructions pour faire peut-être un masque à maison comme il dit, de certains matériaux. Mais c'est très important aussi, même pour les masques non médicaux, il faut aussi assurer que peut-être c'est assez, comme il dit, imperméable pour vraiment, comme il dit, capturer si des gouttelettes respiratoires sortent de votre bouche. Et aussi, c'est un autre principe important de souligner que si on porte un masque non médical, c'est pas vraiment pour se protéger contre les autres. C'est comme une autre option, un autre moyen de peut-être protéger les autres si vous avez peut-être des symptômes, un peu de symptômes et peut-être vous toussez. C'est peut-être plus pour protéger les autres contre vous.
Thank you, Doctor, and that's all the questions we had for today. Ceci met fin à la conférence de presse. Merci.